Hey, Melissa, thanks for being here tonight.
Thanks for having me.
Oh my gosh, bigger thank you on this side of the aisle for sure. Where is that behind you? Is that somewhere up in Washington?
It's Maui.
Oh, never mind. Okay, yeah, okay. I prefer Maui. Paula, how is your sound tonight?
Oops, I can hear you loud and clear, Julie.
Okay, thank you. Thanks for taking notes.
Anytime.
James, thank you so much for being here. How's your audio tonight?
I'm good. I can hear you all if you can hear me.
Yes, loud and
Perfect.
clear.
Awesome.
Click on screen share and make sure that you're able to do that. We'll do a test with James and then we'll do a test with Melissa. It should give you the option. It shouldn't say you need any. Yeah, okay, great.
Cool.
Okay, you can go ahead and stop sharing and then we'll test it with Melissa. Thank you so much, James. Go for it, Melissa. Make sure it's working for you, okay? There we go. Wonderful. Thank you. I'll give another minute for people who are joining right now. All right, we are at 4:01 and I have admitted everyone from the waiting room. I might get distracted as people trickle in, but welcome to your April Hope Advisory Board meeting. Thanks everyone for being here. Special thanks to our guests today, Melissa and James, for taking the time to come help us out in Benton County with a little bit of education about what it looks like in your counties. We will get to them after some housekeeping and a minute's vote. So I will go ahead and start your April meeting for you. Give me just one sec. Okay, just some brief housekeeping with Zoom. You should be muted as you join, and as we do public comment, please type into the chat area your name and the brief description of the topic you'd like to comment on if you want to do a public comment today. And there will be an opportunity to do that in just a minute. So here is an agenda overview of what we'll be talking about today. There will be opportunity for public comment. We'll do a roll call and approve your March meeting minutes. And then we'll dive right into the educational component, which is James and Melissa from a couple different counties here to share how their coordinated entry system works. Thank you for being here. And then there's a brief research work group update. And then I have an update on some added staffing capacity and different community updates. We have saved time for a co-chair's election if that happens today, and hopefully it will. All right, moving on. Just want to touch base with all of our board members and with people who are joining today for the first time. This was written up on the board 2.5 years ago when the Hope Board first met, with many of the members still here and participating, really wanting to set the tone of the kind of culture we have here as a board, with inclusivity and curiosity and respect and kindness. So just wanting to reiterate that for everybody again. All right. I am not seeing anything in the chat. So if there is anyone who wants to make a public comment, please put your name in the chat right now. And I'm going to scroll down and see if there is anyone who's called in on the phone. I don't see anybody dialing in on the phone. And I'm not seeing anyone in the chat. Just in case someone is not able to operate the chat function, I'm going to go ahead and stop sharing and take a visual look here. Is anyone raising their hand or wanting to make a public comment? Okay, seeing none, we will get back to your meeting. I don't believe I have another slide, but let me just, oh, yep, of course we do. We're going to vote to approve your March meeting minutes. There were no edits that came in from any of the board members. And so I am going to go ahead and ask for a motion to approve your March meeting minutes. Brian Cotter, was that you? I didn't hear most of that. I'm so sorry.
Yeah, that was Brian Cotter saying motion to approve March's minutes.
Thank you so much, Brian. Is there a second?
Second.
Second.
Oh, sorry.
Was that Jan Napak seconding?
I think there were a couple of us.
We'll go with Jan. You're the first voice I heard. Thank you very much. And I'll go through and say your name, and please say present and whether or not you approve the minutes, or if you need to abstain if you were not here at the March meeting. Catherine Biscoe.
Present and approve.
Carol Butcher.
Present and abstain.
Brian Cotter.
Present and approved.
Cade Deloach. Cade, I know you're here in the meeting, but I can't hear you if you're trying to participate. You are welcome to put your vote and your presence in the chat as well if audio is not working for you today. So I'll give you a minute, Cade. Anita Earl.
Present and approved.
Thank you. Joel Goodwin.
Here and approved.
George Grosh.
Present and approved.
Ari Grossman Naples.
Present and approved.
Barbara Hanley.
Present and abstain.
Melissa Isavorin.
Present, abstain.
Bria Lewis. I don't see Bria on here, but hopefully she joins us shortly. Cindy Lowlake.
Present and approved.
Charles Mon.
Present and approved.
Peggy McGuire is going to be a few minutes late. She texted me, Peggy, have you joined us yet? I don't believe so. Okay, we will mark Peggy as an excused absence, but I know that she is joining us. Jim Moorfield.
Present and approved.
Good to see you here, Jim. Andrea Myrie.
Present and approved.
Jan Napak.
Present and approved.
Chanel Probst.
Present and abstain.
Nancy Wise.
Present and abstain.
Cade, are you with us now and able to say that you're present and you approve of the March meeting minutes?
Yes, I am.
And do you approve the meeting minutes from March?
Yes.
Thank you so much. Your meeting minutes have approved and we can move on. So this is just an overview of our guest speakers today and really wanting to dive right in so that they can end their day at 5 if they would like to. So James is joining us from Lane County and Melissa is joining us from Clark County, Washington. And really the purpose of them coming here is that your first H.O.P.E recommendation was to improve our data, improve how we coordinate it, the quality of our data. And so I've done a lot of research this winter and spring on other counties who are utilizing what's called coordinated entry for their data on homelessness. And really wanting to pose a couple key questions to James and Melissa about what coordinated entry means in their county, how it functions and how it improves any of their local data or coordination for clients, and how it helps prioritize their most vulnerable folks. So I'm going to go ahead and stop sharing. And James, we will start with you. If you can introduce yourself and go ahead, screen share whenever you're ready. And thank you again for being here.
Yeah, thanks for having me. Hi, everyone. I'm James Gill. I'm the Street Outreach and Coordinated Entry Supervisor for Lane County Human Services Division. I'd hoped my colleague Lisa Stewart was going to be able to join, but she is on a deadline. She holds a lot of the data pieces, so there may be parts of the conversation or questions that I can't answer related to the data, but definitely can talk about what coordinated entry looks like in our community, and definitely, want to recognize that We are in a transition process with our coordinated entry system. And so I'm going to talk a little bit about kind of where we're at and then where we're hoping to go. And I will say, Melissa has been incredibly helpful to me in our development of coordinated entry. And our current manager is a former manager of Melissa's up in Clark County. And so sharing information like this has benefited me and our county greatly. So we're always happy to share it with you.
James, can I interject 1 second before you start?
Yes.
If there are board members who have a question about a particular slide, can you go ahead and put it in the chat so we don't interrupt James? And I've seen these slides before, and if I know he's going to get to your question, I'm not going to call on you right then. But if I know it's only about this slide, I'm going to go ahead and say, hey, James, you have a question from the chat. Okay, thank
Perfect.
you.
Yep, great. So I always kind of start with just to make sure we're all on the same page. And I recognize that some of you may already know kind of what coordinated entry is, but so coordinated entry is a HUD process that really is aimed to ensure that there is equal access to folks in community that need assistance and need housing. And that assistance is prioritized based on vulnerability and severity of service needs. I've been a homeless service provider in Lane County for close to 20 years now, most of my adult career. And I definitely was a provider prior to coordinated entry and now after coordinated entry. And it really has ensured that providers are working with those in our community that need it the most. And prior to coordinated entry, it really, providers had much more kind of, they made those decisions on a program level rather than on a community level. So really, HUD has identified effective coordinated entry systems to have the following kind of qualities. Prioritization, again, those that are most vulnerable in the community are being prioritized for, the limited resources that are available. If all of our communities had all of the resources they needed to be able to house everyone in our community, we wouldn't need to prioritize folks. But because that's not the case, we really need to ensure we're getting those services to those folks. A lower or low barrier approach, access to coordinated entry should be easy, well advertised, should have a no wrong door approach. So someone accessing services from a service provider or engaging with a street outreach team, they should be able to get connected to coordinated entry. And there shouldn't be a requirement, for sobriety or mental health treatment to be able to access those services through coordinated entry. And that really ties in with the housing first approach. Addressing those housing needs first and the other support second, and not having those requirements around sobriety. Person-centered is really kind of goes back to what I was saying about how things were prior to coordinated entry, and making sure that folks are getting matched to the housing programs that meet their individual needs, and they're not just being referred to a program that may not be able to serve them. So, permanent supportive housing versus rapid rehousing, really looking at the person and identifying what those needs are. Sorry, my phone is going off. Fair and equal access. All households seeking assistance really, should be able to access coordinated entry in the same way and receive the same experience. And then having a standardized assessment tool. Right now, our community uses the VI-SPDAT, as I know many communities do, but we are in the process of moving away from that for some issues identified, with racial and gender equity, and also just that tool was never intended to be used as a sole determinant of referral. And then, all coordinated entry systems really should have referral protocols to ensure that folks are getting connected. This graphic kind of highlights what I was talking about before. Coordinated entry, folks experiencing homelessness or soon to be really didn't know where to go. They would go to every single provider, they would call, they would Google homeless in Eugene or homeless wherever, and they would just go a bunch of different places and not know how to get served. Through coordinated entry, it really ensures, that there is a central access point that folks know where to go to get help. They can receive that assistance, and then hopefully their homelessness can be resolved. This again just kind of highlights those main pieces. So that the four kind of core elements are that access piece. So having a robust access. So a phone line, a web-based access, street outreach workers who go out to where folks are residing, brick and mortar providers that know how to get folks connected to coordinated entry. And through that, after they've been able to access, really then assessing folks for what they need. And we're in our county moving towards what's called a phased assessment approach. And that's really kind of starting with that initial triage of what do they need right now? Do they need medical care? Are they fleeing, a batterer? Do they need to go to a domestic violence shelter? Making sure we identify those needs before we start to talk about, a really comprehensive assessment related to housing. After that, we go to a diversion conversation. Can we get these folks some financial help now that will keep them from having to access shelter or becoming homeless? Or can we rapidly resolve homelessness of someone who recently became homeless? So that often looks like helping with transportation assistance if they have a friend or family member they could live with somewhere else in the state. Folks that are living paycheck to paycheck and their car breaks down and they can't pay their rent that month, it could assist with that. It's really trying to keep as many people from having to enter into homelessness as possible. And then I'm not going to go through each of these stages, but after that, that's when we start to do the eligibility and comprehensive assessment for housing. And that's where we determine what type of housing type is going to be most likely to match their needs. And then from there, we prioritize the groups that we are, that our community has determined for prioritization. Right now in Lane County, that's based on SPDAT score and then chronic homelessness. We are moving away from that and determining new prioritization groups, which I'll get into a little bit.
James, can I interject?
Yeah.
Because there's a question that really
Yep.
has to do with the use of coordinated entry. So even if all resources were available, isn't coordinated entry more efficient? So an organization would use it, really looking at this assessment to make sure the referral is to the correct place.
Yeah, the having ample resources was more about that prioritization. I think coordinated entry would still be beneficial, but we wouldn't have to necessarily if we could put every single person that accesses coordinated entry into housing, it would be more about determining which type of housing program is best for them, and not necessarily having to prioritize the subgroups of folks. So that's all I meant. But yeah, coordinated entry still would be incredibly beneficial because it really ensures that the community knows how to access these resources and that folks get connected quickly and get connected to the services that they need.
Thank you so much.
Yep. And then after folks are prioritized, that's, from there, they end up getting referred, hopefully to housing programs. This is the specific process for Lane County, which again, and I'll show, the next slide is going to show kind of what we're hoping to move towards. But so right now we have a variety of what we call front door sites. They are local service providers that kind of target subpopulations. So we have a front door site that's our youth serving program. We have a family serving program, and then we have several different providers that focus on single adults. So that's where we advertise on our website that folks can go to do front door assessments to access coordinated entry. And then in addition to that, we have outreach teams that are all trained to do assessments as well. So once they have gotten connected with a site or with an outreach team, they then do what we call our front door assessment, which is basically the VI SPDAT assessment tool, as well as some additional community questions that we've added. They do that assessment with a trained assessor. Generally takes 30 to 45 minutes, kind of depending on how much additional information the person is wanting. The bottom of the slide kind of identifies the roles in each of these stages. So in the initial front door assessment, the conducting of assessment falls with our local providers, and then they are directly entering that front door assessment into HMIS. So they're enrolling folks in an HMIS program that's called the Lane County Front Door.
James, I'm going to interject
Yep.
to make sure folks who might not be as familiar with the acronyms know that HMIS is Homelessness Management Information System, like a data system, and that FDA referenced later is from that first column of front door assessment.
Yes, sorry, I always forget that acronyms. We need to be clear on acronyms. So
that's okay. I have to remind myself too. You're good.
Yep. So and then in that front front door assessment stage, the continuum of care is responsible. So my staff is responsible for reviewing the data entry that the providers put in and then managing the HMIS system and just ensuring that every piece of information was collected through that process. After they have done a front door assessment, they get placed on what we call our central wait list. And folks are added to this housing referral list. As I mentioned before, it prioritizes based on vulnerability, which is determined through that VI-SPDAT score. And then we also prioritize the HUD definition of chronic homelessness for the folks that we refer. With our current process, clients remain on that list for 6 months. If they get referred within that 6 months, then obviously they leave that list and become referred to a program. I will say that the majority of folks who end up on that list, unfortunately, remain on that list for that 6-month period and then need to do an updated FDA at that point to stay active on that list. We're really moving away from this procedure and hopefully we'll have a more kind of dynamic list that we are in contact with the folks on that list pretty regularly so that we know kind of who's continuing to need the assistance and who may have resolved their homelessness outside of this system. In this stage of the process, providers are really responsible for updating those front door assessment entries with any new information. And if someone has expired after 6 months or is about to, they would be responsible for that. The providers also communicate with the clients and households themselves kind of about where they are at on the wait list, what housing programs they may be eligible for referral, and just keeping in contact with them as they get close to that 6-month mark. Our team with the COC, they manage that wait list. It's an Excel spreadsheet. They send it out weekly to our mailing list of a variety of community stakeholders and it's not the names of the households, but it's, we have this many people currently on our centralized wait list, this many families, this many singles, this many folks who, through the SPDAT permanent supportive housing looks to be their best, the program that could best meet their needs. From that centralized wait list, hopefully we are referring to housing projects as many folks as we can. And so through our coordinated entry system, we refer to a variety of permanent supportive housing programs, rapid rehousing programs, transitional housing, bridge units, which are shelter units for folks that have been referred to one of those housing programs, but have not yet found housing or have not moved into their unit yet. And then in the last 6 months or so, we've really started to move towards case conferencing to help determine referrals. So moving away from that SPDAT score, deciding it, and instead bringing together the providers that are working with these households so that we can determine their vulnerability more accurately and really more importantly, kind of determine what housing intervention they really need. And in this stage, the providers, they're the ones that are accepting the referrals, so we send a referral through HMIS, the provider accepts it and then begins enrollment for that client into their program. And then both the providers and the COC are involved in case conferencing efforts, so we can really determine who and where, these households should go.
James, I'm going to
Stop there.
interject because
Yep.
there's a couple questions in the chat and I'm not sure if you want to answer them now or later, but how long from assessment to some type of housing other than emergency shelter? Where are the biggest gaps and the types of units available? And it kind of plays into Peggy's question of just being on the list does not guarantee someone gets housing, right?
Right. So to answer Peggy's question, that is correct. It does not. And I will, this is a slightly ballpark guess, but I would say less than 5% of folks on the list at any given time are going to be referred to housing. We have I think as this week, we have 675 households on our coordinated entry wait list. And we send, maybe in a good month, we send 10-ish referrals to housing programs. And that's really just because we do not have enough housing in our community. And we did not, and that kind of goes to the question that George was asking. How long from assessment to some other type of housing? I don't have an average for you. That would be good information for me to get. But, I would again say, the vast majority are maxing out their time at that 6 months before they're getting referred to a housing program. The biggest gaps are, we need additional permanent supportive housing units. We have over, I think, 200 folks that are currently identified as permanent supportive housing being, the housing type they need. We are, we have a new complex opening in July that's 45 units of permanent supportive housing, but we need like 150 more. So that's a big gap. Additionally, as I know is the case in your community, we have I believe last I heard, a less than 1.5% vacancy rate. And it is impossible for these providers to find rentals for clients in our rapid rehousing programs. So, every time someone asks me like, what are the issues with home, what causes homelessness? It's a lack of housing. That's what causes homelessness. And our community is no different than other communities in that we need to see vast amounts of affordable housing added to our community. I'm just, while we're in the chat, can you put on, I'm not sure I understand, Jan, that question. If you can clarify a little bit.
Jan, can you clarify what you mean by, can you report on the participation level of your homeless cohort?
Oh, yeah, that's a really bad way of asking the question. I could have just said, what's your percent participation with the folks that, you go to outreach and the client is okay with participating?
I mean, do you mean like how many folks of the larger kind of homeless like our homeless by name list, like how many of those folks end up doing front door assessments?
Yeah, right. Thank you.
Yeah, so we have, like I said, I think this week we have 675 households on our centralized wait list. I think our homeless by name list is at 4,000 or close to it for our county. So I'm not the best at math, but whatever that percentage is. So yes, it's a smaller level. And I think that gets really to our issues with access to coordinated entry. And that's what we're trying to improve. We want to see much larger percent of folks accessing coordinated entry. And that's hopefully something that we'll move to.
So that's one of your metrics then. Great.
Yep.
Thank you.
Yep. This next slide, this really kind of maps out what we're hoping to kind of move to a more formal system of, and we've started bits of it. So, right now folks are getting sent to these kind of 5 front door sites to do their assessments to get into coordinated entry. We are in the process of moving towards having a web-based access point, a 24/7 phone hotline with at least part of the time that being live operators they can talk to. And then we'll also still continue to have those in-person provider sites that folks can go to. So really following that no wrong door approach. And we're really looking into how can we advertise this? How can we, so it's not only the individuals and households themselves that need services that are accessing it, but it's their neighbors, their coworkers, it's, clerks that are working at 7-Eleven graveyard shifts and they come into contact with an unsheltered folks, they'll know, oh, this is the number I call, or this is the website I can go to. And then everyone will then kind of be filtered through a system-wide rapid resolution and diversion. And that was what I was talking about earlier about those kind of light touch financial interventions to keep people from becoming homeless or resolve homelessness for folks quickly. So in this model, they kind of hopefully can jump past needing shelter or additional, other services and just go straight to permanent housing. If rapid resolution is not successful, then we would be talking about, are they interested in shelter, having a live shelter inventory that we can share each day. We have this many beds open. This is what you can expect from these shelters. If they're not interested in shelter, then we deploy our outreach teams to kind of help with services referral and supplies and, getting folks those things. Only then, after we've kind of gone through these stages of the phase assessment, then is when we would do that prioritization and vulnerability assessment. So, in our current system, we do that at the very beginning, and the vast majority of people never receive any service through coordinated entry. So we really want to put all these other interventions first and then move to the prioritization. Getting close to the end here. I know I've been talking a lot. So, these are my opinions on what the benefits of coordinated entry are, but I think that they are shared by a lot of people. So for the households that are experiencing homelessness, it provides that single entry point. They know where to go. They all, they don't have to call 20 different providers. They don't have to email, city and county officials. They know where to go to get the help, and they get it quickly. It eliminates the need, like I said, to individually contact every provider, and they're matched with appropriate service needs. So they are not sent to a shelter that can't serve them because they have a pet, or they're not sent to a housing program they don't qualify for, because we've done that screening ahead of time. And then there's consistency in paperwork and assessment, because it all lives within coordinated entry, and it's not every single provider has their own assessment tool to determine program eligibility. We're all using that same paperwork, which is helpful to folks that are experiencing homelessness and are experiencing trauma, and not having to kind of retell their story over and over again. For service providers, they are only receiving referrals of clients that have already been screened for eligibility. So they know that when they receive a referral through coordinated entry, that's going to be someone that is eligible for their program. They don't have to maintain their own internal program waitlist. That's, the waitlist is operated by the COC. The referral process is handled by our HMIS staff, and household needs are identified upon referral. So they're not getting just, blind referrals where they don't know what's going on with the household they're referred. Because they've gone through that assessment process, they kind of know what the unique and individual needs of each household are. And then for data quality, it really shows you what the need in your community is, not just the number. So, we know we have 675 folks on our coordinated entry list, but we also know 200 of those, through their vulnerability assessment, really need permanent supportive housing. So that can help to influence how our community decides to invest money, and what are those gaps that we need to fill. We now, through coordinated entry, we know, the X amount of households have this kind of going on, and this is the needs that, the X amount of houses have an identified substance abuse or a mental health condition, and that really can help to influence decision making. It measures system performance, inflow versus outflow. Those are terms I really don't like, because we're talking about human beings, but it is a term that is used in a lot of HMIS and language and other kind of systems language. So it can tell you, if you have this many folks entering into coordinated entry this month and you have this many exiting into housing, it really shows you how your system is working or not working usually, and how you can identify those pain points that need to be improved. And again, just identifying those gaps in service delivery areas is really critically important. And then for the community, it ensures that the most vulnerable neighbors in your community are being prioritized for assistance, and that you are having a collaborative approach to ending homelessness, and decisions aren't just happening in bubbles and in silos, and you're really working together to reach that common goal. And then it better positions communities to receive HUD funding. Just, obviously coordinated entry is a requirement of HUD, but it really allows for you to tell a story when you're looking to receive more funding. That's all I got. I will gladly take any questions.
Yeah, there were a couple of questions in the chat, but I think I can elaborate on those questions too. And, one of them is, because you had said only 5% end up really moving into housing, and that's due to obviously not enough places to put them. So if that's the case, like where is the value outside of that? And you spoke to understanding, the need and how that can support, decision making for social investments, which I really appreciate. And I'm sure those 5% extremely appreciate being able to be placed. I'm thinking there's also value in the work that you do to ensure people don't end up homeless. So the folks that are borderline almost houseless, and you had given the example of, do they need transportation? Is it transportation to get to their job so they don't end up losing their job and ending up homeless? Do you track any of that kind of information, those other value adds to your program?
So those are,
James, can I interject real quick and have you stop screen sharing so we
Yep.
can see each other? And then we've got a couple of questions in the chat.
Yep. So that's a great question, Melissa. And I should have emphasized, like, we are really in the preliminary stages of developing our diversion and rapid resolution. And I'm sure, Melissa, I know Clark County has a much more robust diversion approach. So I anticipate that 5%, it's going to become much higher, because right now, folks do the front door assessment, they end up on the wait list, and most of those folks on that wait list aren't getting any sort of formalized case management or diversion conversation from us right now. So as we move towards that system, I think that's where we get those folks connected to housing resources that are maybe outside of the permanent supportive housing and rapid rehousing referral. It's having those problem solving conversations. It's finding out what their social network and circle is, and then identifying what are those kind of one-time payments or those one-time financial assistance things that really make that can snowball and lead to somebody then being able to resolve their homelessness. So we have a long ways to go, for sure, but that's where we kind of help to increase that number. And then also pushing for we need to develop housing in our community, and we can when we say to the decision makers 5% of these folks are getting into housing, I think that helps them to really think, okay, we need to work on that. These other questions I see, Jim, that's a great question as well. So
James, I'm going to go ahead and read the question for folks who don't see the
Sure.
chat. The question is, typically every housing property or property manager maintains its own wait list. Does your central wait list intersect with all these wait lists in some way?
Currently, no. We are, though, working on that. So within the last couple of months, we have created a landlord liaison position that has started here with the county, and he really is working on fostering relationships with local property managers and local rental agencies, and hopefully we will then be able to use those relationships to kind of not only send referrals from the centralized wait list, but also just be able to use those in our diversion and rapid resolution conversations. We do have partnerships with St. Vincent de Paul and Homes for Good. Homes for Good is our local housing authority, and St. Vincent de Paul operates their own low-income housing wait list. And so some of the programs that pull from our coordinated entry system are able to get folks into their house, like bypass their wait list to get into their units. But I will say that a big goal of ours is to merge as many of those separate wait lists as we can in the future, and kind of umbrella it all under coordinated entry.
Thank you so much, James. There was a little back and forth with Carol and Peggy in the chat, but I think you addressed sort of the bigger needs of funding and advocacy and getting money from HUD. There is a question. Can you share a bit more about what your street outreach team looks like? How often it goes out? How often are they interacting with the same people? If they're low on time? Okay, thank you. Yeah, thanks, Maddie. Go ahead, James. We have a couple of minutes. You can answer that.
Sure. And I will say, our street outreach efforts, I'm really proud of. And I think that, where we're lacking in coordinated entry, I think, we really are doing great in street outreach. So we have identified, and now have full geographic coverage of Lane County for our street outreach efforts. So some of that is contracts with local providers, and some of that is actual Lane County staff. So we have dedicated street outreach teams for East, North, South, West, and Metro Lane County. So those teams go out generally, in teams of 2 or 3, and we right now, I believe, have 7-day-a-week street outreach across all of our providers. They're interacting with folks, in the larger kind of encampments, in our rural areas. They're going out into forested areas, and they're making contact, letting them know who they are, giving them, survival supplies, and then also, trying to connect them to coordinated entry or to other resources. Street outreach is really at its core about building rapport. Oftentimes the folks that are engaged in street outreach are not accessing services because they're they've been treated poorly by those services in the past, or, you know, whatever barriers are in place to them accessing. So our team spend a lot of time engaging with the same folks over and over until they've kind of built that rapport and can start doing some of that case management and advocacy work. I also recognize time. I love to talk about street outreach, so I will put my email in the chat and would gladly come back to a meeting or just talk directly to anyone that's interested in street outreach, because that's where I started my career and is really, you know, along with coordinated entry, is really where my passion is. So I'll put my email in the chat.
Thank you, James. Any other questions from our board members before we transition over to Melissa? Okay, well, thank you so much. Yeah, thanks, Melissa. It's important. James, if you wouldn't mind staying on just to hear Melissa's, and in case there's some follow-up questions about the differences in your system, that would be really helpful. Thank you.
Yeah, thank you.
Okay, Melissa, take it away and introduce yourself. Thank you for being here.
Yeah, thank you. Let me make this a presentation screen here. Maybe there. Everybody see that?
Yep, you're good.
Okay, awesome. All right, so my name is Melissa Baker and I'm the Coordinated Entry Director with Council for the Homeless. I really appreciate being able to follow James. It gives me an opportunity to hopefully complement his presentation and not go over like a lot of the same stuff. So I'm gonna try to tailor mine a little bit. And I agree with like everything he said. So right there, caveat. So just briefly, I'm going to kind of go over like a really big, like 50,000 foot level of Clark County's homeless crisis response system. I'm not going to spend a ton of time on that, but just to kind of give you an overall picture of our homeless crisis response system and our continuum of care, or COC. And then I'm going to kind of drop down to about the 10,000 foot level and spend a lot more time on our coordinated entry system and what we do here in Clark County. And then I will go into those questions about like kind of the benefits and how data has been impacted. There's a lot here. I'm going to just like really just glance over this, but this is an overview of our homeless crisis response system. So a continuum of care. Back in 1994, HUD said, make a continuum of care happen. And that what that is like a group of people that are meeting to address homelessness in your community. In Clark County, Washington, we already had something like that. It was called the Coalition of Service Providers. So we just kind of turned that into our general membership group, which is what you see here in the middle. And then the COC steering committee is like the decision-making body that's at the top. And from the COC, the continuum of care, we have all of these task forces and work groups that come from that, which are also things that HUD says you have to have. So just some real brief descriptions. Our HMIS, our Homeless Management Information System, our data entry work comes out of this. So that's like at the bottom left. I don't know if I can you see my mouse? And so this is the body that does the annual point in time count, Project Homeless Connect, which is a nationwide count of people experiencing homelessness on one given night. And it's very underrepresented, but it's a great comparison across the nation of trends of people experiencing homelessness. So as you get into this work, you'll hear about that a lot. And that's what our HMIS users group does. I'm going to spend a little bit more time on the by name list work group here on the bottom right. And then also we have these Housing First cohort and the FCA group. And these are just like wraparound work groups that talk about client case conferencing, try to overcome barriers for people that aren't stabilizing as they would hope, to really collaborate and bring people to the table that are working with clients and have access to resources, have information, knowledge sharing, and all that stuff coming to the table. So you can see there's a lot.
Melissa, what does FCA stand for?
That group has been renamed and I can't remember what that stands for because we haven't had it for 2 years.
No problem.
That group represented our rapid rehousing, so like that medium level of need. that folks get referred into program for, it was those folks that attended that meeting. And then the Housing First cohort, that was more of that permanent supportive housing, so the highest level of need, the folks that score into that program, that's who would be at that meeting. So those are the people at the table. We renamed them, we're re-implementing them because they haven't been going on a lot during COVID, but now we're able to kind of jump back into that. As far as processes go, we have our by name list work groups, which is kind of what it sounds like. The purpose is to know by name everybody that is experiencing homelessness in our community. We are still implementing this. It's a big thing. So right now, as far as like working coalitions where we're talking about people, we're making things happen, we're working with other people at the table, and we're going by name through the folks that are on the radar that are homeless in our community. We have one for veterans and have one for the chronically homeless community. So that means they've been homeless a very long time. HUD has a definition for it, but it's complicated, but over a year generally with a disabling condition. And we're very excited to soon have a youth by name coalition is going to be going. And so the goal is to have one day have every single person be on a by name list so that we can go through, know their barriers, know their challenges, know what's going on. And then come up with action steps to help them overcome whatever they're ready to work on. And then you assign like a point person, like, oh, well, I'm working with Joe, so I can go and do his housing assessment or help him access this or get his ID or whatever it is that he needs. So big overarching structure of our homeless crisis response system. So this is our coordinated entry system. And I'm just going to kind of walk through left to right, explain all the arrows and boxes. Please ask questions if I'm unclear. So I actually, Julie saw me at a presentation last week and a different one of these. And so this is today. Kate made the other one. I was like, that is actually needing to be updated. So in a really good way, because we, similar to what James was talking about, we really embrace that no wrong door. So we used to be a single point of access where you would call like that. The housing hotline is our phone hotline where people are answering the phones, screening people, entering their system into entering their information into HMIS and getting them into the system. Or they would walk up to the Housing Solutions Center, which is our direct service office. And that was it. That was basically it. That was how you accessed coordinated entry. We realized over the past several years that that's not equitable. There's people out there that can't make a phone call. They can't walk up to the HSC, or they don't want to. They're not comfortable talking to us. They have been burned by systems before, and we want to end homelessness, right? Which means we need to be able to serve everybody, and we weren't doing a good enough job at the time to help everybody access the system that wanted to. So what we've been doing is we still have, walk up to the HSC or call the housing hotline. Those are still like the main access points being utilized. But what we've been able to grow in the past, just like a year, really, we got a grant for a coordinated outreach, and it's super exciting. James, we should talk, but it is it's a coordination effort. And so Council for the Homeless now has an outreach department, which we didn't have before, mighty team of 5, and one of those roles is a coordination systems manager, where he works with the different outreach providers in the community. The requirement is that because it's a county grant, the county funds this grant, that any county funded service providers that do outreach would be required to work with this coordinated outreach. But the reality is over 80% of people doing outreach in Clark County are participating in this, whether they're funded from the county or not. Because it's great. It's really exciting. And Cody, our manager, does a really good job of like helping people get buy-in and working together. And so what really cool thing does is it helps reduce redundancies. It makes it so that we don't have 3 agencies going to the same encampment providing services. So we can like make sure everybody is reaching out to people who haven't already been connected with. It allows us to go deeper. It builds us, it gives us capacity building so that we can actually reach out to more people, find more people, because we're not doing the same work over and over again. And this is a really important part of those by name list coalitions, because those are the people that are at the table, and they're the ones that being like, hey, I know this person, what are the next steps? Let's get them assessed. Let's do these things. Let's break down barriers. Let's have resource navigation conversation. And at all points, at all of these points, whether you're walking up, you're engaging with outreach, you're calling the housing hotline, you're working with one of our partner agencies who's been trained to do the housing assessment, at all of those points, we're using a diversion approach. Because diversion, the way we use it, is an approach. It's not a program. That gets kind of confusing in our community. It's something, it's a way that you interact with people. Where you're being client-centered, where you're walking alongside of them and addressing the barriers that they want to address. And we're doing that like at every step. So once they've accessed the system in whatever way they've accessed it, that resource navigation piece happens. And from that, some people at the bottom there, some people self-resolve out of that light touch support. They don't realize that there's any other options. Someone helps them see some other options, and they're like, hey, I can do this. And they become housed or stabilized. From that initial touch and that resource navigation, there's a lot of reciprocating arrows here. What is going on? What this means is that you can go in any order to any of these and access any of the other ones as well. So it could be like, okay, let's opt into a housing assessment. Let's do a housing assessment. Well, they can also score into diversion because they don't have a lot of barriers, and that's like the lowest level, lightest touch. So if they're really low barrier, they could score into diversion and also be placed into shelter. Like they can do that. If they go to shelter first, they would get a housing assessment, or they could opt into just doing diversion instead of a housing assessment. It's really the client's choice. Somebody could do a housing assessment, score really, really high, have a lot of vulnerability. But they're like, no, I want to work on stuff. I want to go to diversion. We'd be like, okay, if that's what you want to do, then do it. So really, like just getting access, doing what the client wants to do, and making sure that they're just like on all the radars that are appropriate for them and that their needs are being addressed. The biggest, I put client ops in here because it's very, very important. We are not going to send someone to diversion who doesn't want to do diversion. We're not going to assess somebody who doesn't want to be assessed. And we're not putting people in shelter that they don't want to be in. It's client choice is key. So again, from this point, another opportunity, somebody could self-resolve at this point, like with the access to conversation and resource navigation, assessment, whatever it is, getting into shelter, they can get housed at this point. No program supports. Right. So this is another area where people can not have to utilize program supports. So the next step is from the housing assessment, like what James talked about, we have like the different levels of housing. So permanent supportive housing, again, highest need. It is what it sounds like. It's permanent, it's supportive, and it has housing funds attached to it. And then rapid rehousing, that's like the medium level of need, somebody who might need, a few months, maybe even a couple of years of assistance, but they're not going to need it for the rest of their life. They will eventually self-sustain. That's right here. And then they can, again, score into diversion. They can score really low and go into diversion. And anywhere between the housing assessment and being placed into program, they can self-resolve. In fact, a lot of them do. It's nice to hear when our housing coordinators, the ones that do the housing assessments for council and the ones that do the placements, when they're reaching out, there's like, oh, I moved out of town. I found family to live with. I got how, like they can spend a very long time in what we call the priority pools. But when we're reaching out to see if they're still eligible for program, they're self-resolved. And a lot of that happens. And so that can kind of give folks hope, because it can be pretty hopeless when you're doing thousands of assessments a year and you only have hundreds of placements. And so priority pools are what we use for permanent supportive housing and rapid rehousing to kind of hold folks until a placement might come up that they're eligible for. It doesn't function like a wait list for us. So we stopped calling it that because it confused people. And back before we had everything going into HMIS, we actually used like an Excel spreadsheet. So it even looked like a wait list. And people would be like, where am I on the wait list? And untrained volunteer staff would be like, oh, I see you're on line number 82. And be like, no, that's not the way it works. So that was really scary for a brief period of time. We addressed it. And so they're priority pools, and we literally cannot predict a timeline, because we don't know, like, is this housing agency or that housing agency going to have capacity to take on a household? How many households? What are the eligibility criteria? Do they have to be youth? Do they have to be veterans or families or whatever? We don't know. So until we get those placement requests, that is the only moment where we're like, okay, now we know we're going to look at shared living for veterans. And so we know we're going to pull from the rapid rehousing priority pool, filter it for shared people who said, yes, I'm okay with shared living, filter it for people who identify as a veteran. And then we have an actual list now, but only until that moment can we know, like, okay, I'm going to call this person first and then this person. So literally cannot predict a timeline. In addition to our priority pools, you're able to have access to like HUD funded or COC funded programming. And we're very, very lucky, very, very lucky. We have a very close relationship with our housing authority. In fact, they're my boss. They are our employer of record. And so I recognize this is not common. And it has allowed for tremendous coordination, and I would highly recommend it for any other community. And so we can, since the Section 8 lottery, there are certain priorities that come through coordinated entry. So we put them on the lotteries for the housing authority. And so we can do that. And then there's a program called Foundational Community Supports. And this is a Medicaid funded program that is case management for permanent supportive case management and help them find housing. So that's just like another example of outside of the traditional priority pool system. And then we also have a really great relationship with our Veterans Administration, which I know is also kind of rare.
Listen, can I interject and make sure I understood something correctly?
Absolutely.
Did you say that the Section 8 lottery with your housing authority includes some kind of prioritization from your coordinated entry list?
Yes.
Rad.
Yep.
Okay.
So people can be put into the priority pools for that kind of housing program support, rapid rehousing, permanent supportive housing, and also potentially be eligible to go and get in the lottery for Section 8. And then we would do that. And so we get them on all the radars possible. And it's really important during all of these conversations, that resource navigation piece. We tell people, like, we are one basket. Let's get you, don't put all your eggs in one basket. Let's make sure that you anything you're eligible for that we know of, let's give you these resources, help you access these resources, because we are not the only way to resolve your homelessness. In fact, similar to James, I think ours is about 10% of people who have a housing assessment. No, 10% of people experiencing homelessness at least one time throughout the year get placed into a program. And that's how they resolve their housing. So that's not other self-resolve or Section 8 or any other thing. That's just rapid rehousing, permanent supportive housing. About 10% of folks that experienced homelessness one time during the year were placed into a program. I'm going to pause for a second. I think this is also appropriate for this slide. So with our by name list coalitions, I heard the question being asked of James, and I thought it would be helpful if I also touched on it. When somebody gets a housing assessment, it's good for 6 months. And that is because we started with the VI SPDAT. We recognize it is not an equitable tool, and we changed it. So there's a lot of the structure is still there of a lot of the questions, but we've added things, we've changed the wording, we've made some of the points a little bit different, and we made it more representative of our community and the vulnerabilities represented here. Not perfect still. We're going to keep working on this thing, but it is a lot better than what it used to be. And it has shown measurable difference based on data. And so they get a housing assessment. There's a lot of questions in there that say in the past 6 months, in the past 6 months, like how many times has this happened in the past 6 months? So we're like, okay, so 6 months, that's how long the assessment's good for, because things change. And so we want to make sure we have the current information. They don't fall out of the priority pools. Nothing actually happens to them. It's just that if they come up for a placement, we know we need to update their assessment because things have changed, probably. So they don't like fall off a list or disappear. They don't disappear until we know they got housed or moved or something like that. Otherwise, they stay open and stay in the priority pool. And then for the by name list coalitions, we have an inactive policy. And so if somebody is not accessing services at any point in the system, anywhere, like the giving closet, like a food or clothing bank that enters into HMIS, if they haven't accessed anything in 3 months, then they get moved to inactive. They're not taken off the list, they're just moved to inactive. And that's because the purpose of our by name list coalitions is that case conferencing piece. We need to find these people and work with them in person. And so we used to spend a lot of time trying to find people, and these people were housed or moved, or maybe they, I don't know, something. So they're only on the list if they're like actively homeless in our community. And then once they come back, if they come back, they're put right back where they were. So they don't lose any ground just because they went to inactive. Okay. Okay, I think I can move on. No, I can't. So the other thing that we're working on, and it's just started, baby steps, and I can't officially say it's something we're doing yet because we haven't officially been doing it. But something that we're trying to do is work with Pathways. So Pathways is a medical model. You probably heard of it from somewhere, but it's a barrier reduction model, basically. So we have a team of folks at council, and we also have other teams of folks at other agencies that for us, if somebody scores into an area that like is kind of a black hole, so like really low permanent supportive housing, but outside of rapid rehousing is like kind of not as many options there. And also we're focusing on seniors because we don't have enough staff to do this with everybody yet. We'd have to grow in that, but we're trying this. They get referred to Pathways, and the folks at Pathways are kind of doing an upstream. They're helping break down barriers for the clients, hopefully housing them. I mean, they've been doing a tremendous job housing them. And if they don't get housed, they have less barriers. So if they can go into program, then they have less to work on, and they're more likely to be housed and stable in program because we started working with them early. And maybe we didn't house them, but we helped them so that they could better stabilize. So that's kind of like coming at it from the other angle of working with people before they go into a program, if they go into a program. Now I can move on. Okay, so how has coordinated entry affected our data quality? So we have an open source HMIS system. And what that means is that anybody and everybody can see where a certain person is, as long as you have a license, there's a release of information to see it, all of those things are in place, and there's permission and stuff. So I can see that they've received services from a housing program, 5 years ago. I can see if they're currently engaged in services. I can see like, oh, wow, with our by name list coalitions, we can be like, oh, well, we see that they're working with this agency. Let's connect with that person so that they're, already utilizing a relationship that they already have, right? And so everybody can see everything as long as your permissions are there. There are things that affect this, like we have some behavioral health agencies that enter into HMIS, but because they have like HIPAA and all the things that not everybody has to follow to that extent, they have very high visibility restrictions. So like I couldn't see their information. Only our HMIS administrator is the only person who could see that information. And so there's definitely privacy policies there. So coordinated entry affecting our data specifically, I think the biggest effect that is happening, and I bring up that open source HMIS system because when somebody accesses the system, the first thing you do if they aren't in HMIS at all, brand new, right? Brand new to the system, you fill out a profile and it has all of those universal data points that HUD requires you to put into your data. And plus a lot of other things because we can personalize our HMIS however we want. And so like somebody at the housing hotline, an outreach coordinator, they build the profile and they put in all that information. Now all that information is already there for the next person. So we're not having to enter it again. And it ensures just better data completeness because it happens like right at that initial point, and then it can carry all the way downstream. The other thing that because we have that open source HMIS system, and because we have the coordinated entry and the coordinated efforts, we have wonderful dashboards. All of you right this second could go on our website and see them because they're public. And so we have a data quality dashboard, which is very helpful because it ensures that it's a public dashboard. Anybody can see it. So I can see how my staff are doing entering in data, and I can see how this other agency's staff are doing entering in data. And so who wants to look bad, right? So everybody it like helps incentivize people like, this is public information. I need to make sure I enter in quality data and timely data because it's timeliness and quality, which is kind of a bummer sometimes. But anyway, it's all there. And so that really helps with the quality assurance for our data. And then we have a couple other really exciting dashboards. There's one that is for like services and referrals. So you can go on there and you can see all the shelter programs, all the rapid rehousing programs, transitional housing, permanent supportive housing, like all the programs, all the agencies and everything. You can click on it and you can see how many people they served, how long they stayed in program, positive exits into housing, what percentage of people were chronically homeless. You can filter it by race, ethnicity, age, household type, all of these things. So you can basically answer just about any question you want about services in Clark County, Washington.
Melissa, can I interject because there is a question in the chat, just a clarification from before. Did we understand you to say that people using food banks are also entered into coordinated entry if applicable?
Yeah, I mean, if they're receiving certain funding source, they're required to, but we have a lot of agencies that want to, because they recognize that they can better serve their clients if they know where they've been, where they're going, and what's been going on with them. So yeah, like the Giving Closet, that's one agency that is like clothing. It's like a clothing bank, basic needs, and they enter into HMIS. And we have a lot of other agencies, not like our county food bank does enter anything, but there's a lot of agencies. In fact, I got asked, Dale, we have 29 agencies with over 200 different unique programs that enter into HMIS in Clark County. And so it's a lot. I'm not gonna lie, CARES funding, the prevention money from the federal government for homelessness prevention, a lot of people started entering into HMIS because they got the money and it was a requirement. But there's a lot that just do. And so, yeah, that is correct. If they can, anybody can, if they work with the homeless population or serve folks in our homeless crisis response system, and that includes prevention, they can say, hey, I want access to HMIS. And then we usually scholarship a license for them. Don't tell everybody that. And then we give them training and they can do it. So it's pretty cool.
Thank you, Melissa.
Yeah, the last dashboard that is super cool is our equity dashboard. We can do like an equity report and talk about based on like we can show that the overrepresentation of folks of color, folks that have been historically marginalized, and like how overrepresented they are in our community. Compared to like how many of them exist in our communities, like the census data versus the homelessness data, and how many of them access services, where they access services, and we can really, just hone in on like how do we better serve these folks that don't have as good access to the system as folks who are able-bodied, dominant culture groups.
And I am guessing better equitable data also affects the kind of funding that you can draw down for those groups.
Yep.
Follow-up question before you move on to how it's affect your funding. Do all of your social services participate in this program, or are some unable to? Did your council train agencies on the system, the format, the data requirements, et cetera?
Let me look at the chat. I want to read that one.
And Melissa, if you don't have any more slides, you're welcome to stop screen sharing.
I think I have one more, but let me
Okay.
see if it's super. I think because I realized that like the funding part on this previous slide, it's my answer is the same as James. Like people can they can apply for funding that requires going through coordinated entry that they wouldn't be able to apply for before. And so it opens up funding opportunities for folks. Let's see, do all of your social service. So there are some that do not. There are some that are like private funded that do serve the homeless population. And then we have a very strong partnership with like our faith community. And they're entering into HMIS. We have our churches, our severe weather shelter church partners entering into HMIS when they provide shelter or in the winter, in the severe hot and cold times. And so
and you're doing the training for those folks, even if they're not getting any kind of HUD funding.
Correct.
Yeah.
Yeah, we want everybody, like we really would love it if just everybody would be entering, everybody would be entering services into HMIS, and we provide the training. So for Washington State, Clark County is kind of a unique anomaly, and I love it. So there's like 3 counties in Washington State that don't go through the Commerce HMIS system. Every other county has to go through the Washington State Commerce's HMIS system. That's where all their technical assistance comes from. That's where if they want to report, they have to ask for it from there. So you can imagine that's kind of going to be kind of tough and inflexible, right? It's a department that covers almost an entire state. That's a lot of work. And so Clark County, along with Spokane County and one other county, we have our own HMIS administrator, Mr. Dale Whitley, who is an amazing person, and we have our own team. And so when we need a report, when we want to change something, do something different, when we want to add a question into HMIS, we just ask Dale and he does it. So we have a tremendous advantage where we can tailor our HMIS system. We can pull really cool reports and like things and use them and publish data that normally doesn't get published. It's definitely a huge benefit.
Melissa, we have quite a few questions in the chat, but I think I'll wait until after you're done with your last slide, and then you can stop screen sharing and we'll get to questions.
Okay, no, and really I could probably just stop sharing because James also did a great job covering this, where coordinated entry, like you're better able to serve clients. You can do warm handoffs between the person doing the placement and the agency that is receiving them. So therefore, the agency that is receiving them doesn't have to find them, right? That's what happened before, is like you just have to find them. We're going to do that for you. We also, it's our job to make sure you can pass an audit, right? So we do your file. We have to know the funding requirements. We have to know your agency requirements, and then we have to give you a file that meets those requirements. What happens after that's up to you. Like you can totally botch it after we hand it to you if you want, but what we hand you will pass an audit. And so that's another thing that better for the providers, and ultimately for the clients. And so, then the last little point there is, using the least cost burden, method of stabilizing somebody first, is what coordinated entry helps you do. James touched on how like people would just they'd have to know where to go, Google it, find it, know how to access it. And then once placement, if funding came up, the agency would have to find somebody, and it would have to be a good fit. And most of the time it wasn't. Sometimes like somebody needs, I just need a deposit, I just need a deposit, maybe a month of rent or something like that, and I'll be fine. Well, I have a permanent supportive housing placement for you. Here you go. And so we would be spending thousands of dollars on a household that doesn't need that level of assistance, and vice versa. Somebody needs PSH, but they get a deposit. And so it's like, great, you got housed. Next month, you're going to be homeless again. That just causes trauma and harm. And then they're back in the system again. And so that's the other benefit of coordinated entry is cost effectiveness. Like you're going to right size programs to the need, because we can prioritize based on vulnerability from this assessment tool. I'm going to stop there and stop sharing.
No, thank you so much. This is super helpful. There's quite a few questions, so I'll start with a couple at the top here. Peggy had a follow-up question to Jan's. Who does the data quality reviews, since that's essential for competition and granting? Does that make sense? Or Peggy, do you want to clarify that?
Yeah, I just want to understand what you're referencing.
Sure,
or
happy to clarify. So we are members of the ROC, which is the balance of state in Oregon. And what we find is that data quality is an issue across the HMIS system, that if there are entities within the system that are not being careful and ensuring that they have appropriate data entry, that there aren't missing items, aren't incorrect items, that then we rank lower in the scoring on the competition for the funding.
Mm-hmm. Yeah, absolutely. So a lot of that is addressed with our public dashboard. If your box is green, that's good, and so our HMIS administrator is the one that manages all of that and publishes that. He has a team. It's not just a team of one. He has a little bit of a team, and they publish that. And when it's time for like reporting and stuff like that, they are very busy for that week, and they provide all of the reports for all the programs. And then there's a lot of flexibility. So for example, our housing hotline, they touch a lot of profiles. They work with a lot of people. And so it's really important that we are like on top of that data quality. And so besides the dashboard, we want it more frequently than what the dashboard can update. So we just ask for a report, and it's like a report card basically. And so we can go operator by operator and say, here's your data quality report. Now you can have some desk time to go fix any errors that you made. They fix it. And so it doesn't help like in the moment of the data quality, but when it looks like the year end or whatever, the month end, if it's fixed, then it's good. And so we do that internally. And that's also stuff any provider, any agency could also do that as well for their staff. Does that answer your question? Cool.
Melissa, just to clarify, the HMIS system you're using is Service Point that's supported by WellSky.
Yep.
Okay. Yeah, that's the same as what we have
Or
with
Bowman. Yeah, Bowman.
Rural Oregon Continuum of Care.
Yeah.
Okay. Hopefully this is an easy one. How many volunteers or staff are working for Council for the Homeless? Or maybe that is a very hard question.
Between admin, direct service staff, volunteers, interns, we have about 55.
55. Okay.
And I can tell you 2019, we had about 30.
So you've almost doubled your staff in the past 2 to 3 years.
Yeah.
I would love an org chart sometime, Melissa. Follow-up email. Do non-governmental individuals like the church volunteers you were talking about have access to personally identifiable data, or do they just have data entry access?
They have access to personal identifiers, and that's after they get permission from the client to do that. So we have them sign a release of information, or if it's over the phone, we get a verbal, and they're good for only a month if it's a verbal, and it's like 2 years if it's signed. A lot of verbals over COVID. So like they meet with the person that wants shelter. They come to us usually first. We refer them to shelter in a severe weather event, or sometimes it's just walk up. We have a church that does walk-in shelter, and they have them sign like it's okay for us to enter your information. They can also refuse. They can totally refuse, and we just do like an anonymous, no identifiers in the profile thing. That happens a lot with like DV survivors. And so we get permission. They put the identifiers in there, and the client understands that this is a database that, you know, homeless service providers are accessing. It's not for like the public, it's just for homeless service providers and people working in the homeless crisis response system. And so they understand what they're giving permission to before we put their information in there.
One sort of fact I wanted to highlight as we're talking about how many staff you have or how much street outreach you can do. Clark County has about 490,000 people, which is almost 5 times larger than Benton County. So just for some scale of how much bigger Clark County is from Benton County when Melissa's answering this. I'm going to do one last question and then we're going to have to move on. Do you see or experience any negative aspects to coordinated entry? Is this ever a barrier to engaging with someone who may have needs but not want to do coordinated entry? And I think you just touched upon that a little bit in your previous answer.
It's our job to make sure that the client doesn't feel the burden of coordinated entry. Like that, the job of coordinated entry is to take the burden off the client. And so we don't say, you know, street outreach worker, Cody, hey, how's it going? I need to walk you over to the Housing Solution Center so you can access coordinated entry. At that moment, Cody is coordinated entry. If a shelter provider is like somebody gets referred to shelter or it's a walk-in shelter, the shelter case manager is the access to coordinated entry. We want to make sure that the client, again, it's like they don't have that burden of making sure that they have access. It's our burden to make sure that they have access. So if they don't want to work with Council for the Homeless, okay, we can totally hook you up with a lot of other providers. Like, who are you comfortable talking to? You want to talk to Lifeline? Great. You want to talk to this other agency? Sure, let's do it. And they'll still have the same access to services. They'll just be working with somebody that they like, because not everybody likes us. I know it's hard to believe, but it's true.
How could someone not like you, Melissa? There was one clarifier in the chat, and Bria, I don't know if you're able to clarify the comment you made about what the worst part of it was, or if you want to elaborate on that at all, but I wanted to give you the opportunity because someone wondered what you meant.
So going through, can everybody hear me, first of all?
Yes, we can hear you just fine. Thank you.
Fantastic. I'm actually using my phone instead of my computer because it's a lot easier. So what I meant by that was like when you were talking about how it's like taking that burden and having to go through Google and find those services, that was one of the harder parts of trying to find housing, because it was always like, oh, we have a waiting list that's about 3 years long, or it's like we don't do certain services, like we can't provide this much money for your rent, or it's like we can help you this month but you have to prove to us that you'll be good next month. And you know, working, you know, per hour, that was kind of hard because the paycheck would change every 2 weeks. So 1 minute they're like, oh, okay, like you're qualified for rental assistance, and literally 2 weeks later it's like, no, you make too much money. So that's what I meant by that was the harder part in going through that system, because there was no coordinated entry. There was no, you know, someone you can just go, hey, and they're like, cool, let's like help you out with this. There was no, you had to do it yourself and pray to God that, you know, you found the right fit, which 9 times out of 10 you didn't. So
you had to figure out where you could be eligible, as opposed to you just sharing where you are and your experiences, and then the folks on the coordinated entry side figuring out what you're eligible for and referring you to something that they already know you qualify for.
Yeah. It wasn't
Yeah,
great.
just think about like how high functioning do you have to be to do that? You have to be really high functioning. And people who are outside are in crisis. Like think about the last time you were just like really, really, really stressed out. You know, how well did you process information? You know, you don't process information very well, much less doing all of that. And so it's, yeah, I completely agree. And the vulnerability-based system, I think the assessment, the VI SPDAT, and also our CCAT, the Clark County Assessment Tool, it is asking the question, how likely is it that this person is going to die if they remain on the street? That's what that's the vulnerability question that we're asking. And so when they get scored, you know, it's like the highest in our system right now is like a 21. We just found somebody for the very first time yesterday that through our new coordinated outreach efforts that had never touched the system, and they scored a 19. And it's like, that's really high, you know? So yeah, absolutely. Big fan of coordinated entry for sure.
Melissa, I'm going to interject. Bria, thank you for sharing your personal experience with everybody. That was really helpful, and I appreciate that. Any last questions for James or Melissa that are quick? Would take a couple of minutes only. Melissa, I would love to ask if you can put a link to that Clark County dashboard in the chat for folks who would like to see what you're talking about. James already put his email in the chat for people who want to connect. And Melissa, if you wouldn't mind doing the same. I know you have full-time jobs in counties that are not Benton County. And so I really appreciate you letting us have access to you and answering our questions at more than this meeting. Thank you.
Which dashboard did you want?
Your data dashboard. You said you can go online and we have dashboards and you can search by equity and race and homelessness and being able to see all of your data dashboard.
Okay.
Thank you so much.
Yeah. I'm just trying to figure out the best way to give this to you because there's like different links for each dashboard.
You know what, put a main one in the chat for everybody. And then if you want to follow up via email, and I can send out however many links you'd like to share with the board.
Sounds good. I'll do that.
Also for everybody tuning in, James already sent me his PowerPoint. Melissa, if you could send it as well, and I will include it with the meeting PowerPoint for tonight so that it's on the HOPE website within a week and anybody's able to see it. Thank you both. On behalf of all the HOPE board members, thank you.
Happy to be here. And definitely
thank you for having us.
If you have any questions, feel free to reach out to my email.
Thanks, James. Thanks, Melissa.
Thank
Good to see you, Melissa, as well.
Good to see you, James. Bye.
Bye.
Well, you two can go ahead and sign off. And we've got a couple more things to cover with your last half hour of your meeting. What an informative hour and 20 minutes. That was exceptional. I'm still processing it all. We're going to shift gears a bit, everyone. The research work group met again within the past month, really trying to answer the question of what research can the HOPE board do to inform existing implementation efforts in the community. And just to give a preface of the purpose of this work group, how can the HOPE board support what the city and county and CSC and providers are trying to do to implement HOPE recommendations so that what you are researching and the educational components you're looking at are timely and relevant to what's going on out in the community. So I will go ahead and hand it over to you, Andrea, to share what your research group is going to continue to research. They don't have a report back to you yet, but this is a status update from their work group and what they are researching in the next month.
So we've been looking at some models and some questions that pertain to where we're headed with our HOPE priority areas. And one of the research topics that seems to, or one of the topics of question that seems to come up a lot is how we would build our organizational capacity. As we just heard, that's a lot of organizational capacity to expand our ability to transition people out of homelessness. So and just looking at more of how can we support providers to be able to provide more services or different kinds of services in different ways, if that's something that they want to do. And so We're looking at an example, the Rogue Retreat in Medford. I think many of you have heard of them, or some of you have heard of them, but very rapidly expanded from running a shelter to having a number of different locations for transitional housing and permanent supportive housing. And Julie is going to be looking at other nonprofits and how they've grown. And so one example is the Portland Homeless Family Solutions group.
And really getting into the nitty gritty of like, how did you fund this? What consultants did you use? How did you build org capacity or become more equitable? How much did it cost? What were your multiple funding streams? And just to highlight that your HOPE Advisory Board recommendation A, sort of those 3 foundational recommendations that came before your 12 policy recommendations, A was capacity building. And so focusing on this really aligns with your recommendations in that way.
And so there's some other strategies, models that again relate directly to some of our priority areas that we're exploring. And so one that's been sort of a hot topic, or an approach that's gotten a lot of interest, is Built for Zero. A number of communities across Oregon are participating in this model. There's been some effort to expand Built for Zero across the state. Right now, they don't have a lot of capacity to necessarily support a project here, but we don't know enough about it yet either. So Julie's going to look into this more to see if we can have a speaker come and talk more about what this means. And my understanding really, from what I remember, Built for Zero is really trying to design the system so that you can basically end homelessness for different populations. So a lot of times the focus is on homeless vets or homeless seniors or specific populations, with the goal of having a good system in place so that you can actually end homelessness.
Well, what I learned in the research on who's doing coordinated entry well is that all the folks doing well with coordinated entry opted into Built for Zero, because it brought a lot of technical assistance and capacity building and guidance and process to how to have those by name lists. And so when Melissa was referencing the Veterans Coalition or the Chronic Homeless Coalition and those by name lists, that was a recommendation from Built for Zero to get to functional zero for those subpopulations. So I'm trying to figure out how that might work here and what it would look like for us. Okay, go for it.
And so another model that that there's been some interest in, I'm particularly interested in, is the Fuse model. And so this is something that they've done in Lane County, other communities in other parts of the country. And Fuse stands for frequent users of something, emergency services, basically. So, people that are being are frequently seen by the ambulance service, by the ER. They're coming in and out of jail, things that are just services that are really highly intensive and cost intensive. And so trying to understand really the group of people, like I think in Lane County, they started with 20 people, like the highest utilizers of services in the community. So trying to understand more about how this works and some of the partners involved. And so I'm going to be doing some outreach to Lane County. We have some other research to do about Fuse. And then also just trying to understand how Fuse would work in conjunction or, work in tandem with the hub model that we've been researching as well.
Yeah, the situation table model of care coordination. Peggy, thank you. It's frequent users of services engagement.
Thank you. I knew it was something like that. These acronyms.
And I just wanted to follow up to make sure to note that I'm doing my best to coordinate your educational topics at your HOPE meetings with what this research work group is working on and also what is relevant for our community. And so looking at IHN and what they do and how they touch homelessness and population health, looking at Built for Zero, looking at Fuse, and then at your May meeting next month, inviting drug court and community court to know what they do, how are they serving the community, and how are they separate and distinct from some of these other concepts of coordinating care. Melissa Isavorin, I'm going to pass it over to you to talk about IHN's Research Institute. Melissa, are you able to unmute? I can't hear you if you're trying to talk. Well, perhaps she had to pop off for an emergency. I don't see her here. That's too bad. She was here earlier. I can just give a brief recap. But in our community health network coordinated care organization, IHNCCO, which is the Medicaid insurer over the Tri-County, Lynn, Benton, and Lincoln area, they have invested in having their own health research institute. And it's just getting going. And they're also interested in how to partner with or collaborate with OSU's Policy Analysis Lab, often called OPAL. And so Melissa Isavorin is going to make sure to explore what the possibilities are for IHN's Research Institute to do some of this research on these timely topics for the city and the county and the HOPE recommendations, and then what might be possible to inform OPAL's research efforts. And so hopefully she can provide an update on that at the next meeting. I've got a quick update on staff capacity. The county has recruited for a project manager to support implementation of the HOPE recommendations. And I am thrilled to stop sharing and introduce you to Rebecca Taylor, who is our brand new project manager with Benton County for the next 2 years. She's been here for like 1.5 weeks. So give her time. She's got fantastic experience. And Rebecca, if you want to take the next couple of minutes to go ahead and talk about your role and what you have done previously. It is still evolving and it might evolve over time, but I am thrilled to have Rebecca here. Yay.
Karen Rockwell's not thrilled.
Oh, Carol, you had to go there, Carol. Come
Not
on.
thrilled. She's not thrilled.
Rebecca, maybe you
All right,
can
well,
say why Habitat for Humanity is not thrilled to lose you.
well, with that introduction, I am thrilled to be here. I'm also realizing there is a lot to learn, and the work that has been done before me coming here, it's amazing to be part of this team of compassionate community builders. So, yeah, like Julie said, I'm very fresh into the job, and overall, you know, I think just the overarching purpose of the job is to try to implement on the ground projects that align with the policy recommendations that HOPE has developed over the last 2.5 years. My background is kind of a patchwork of, I guess you could say, kind of eclectic. Or so I worked for about 8 years at the Benton County Community Development. And had built quite a bit of knowledge in, as far as like building and planning, and did some large projects through that. And then I spent some time at Benton Habitat for Humanity as their construction manager to help them finish a few housing projects that they had. And that was a great experience as well to really engage kind of peripheral to this topic. And so I'm just really excited to be part of this team of people in our community. So I'm very ecstatic to be here, and yeah, look forward to meeting each of you individually.
Thanks so much, Rebecca. I'm thrilled to have a teammate. Yay. Yeah, Carol, do you have a question?
You know, my ongoing saw or issue has been how to continue to make the HOPE work visible to the public, so that people say, oh, because I still get the, well, what's HOPE doing, et cetera, question. So is there an option of doing a story on Rebecca and tying it in with, you know, HOPE went through this process, we developed these priorities, and now we've hired this person to do it. I don't know, you know, Jim Day would have taken it up lickety split. I don't know about the new people who are at the GT, but it's a nice way to surface things about HOPE without it being just about HOPE. So that's my comment, and I'm sticking with it.
Thank you for the feedback, Carol. We do have half of our health department communication coordinator time now, but she has spent quite a bit of time the last 2 months training her replacement and getting trained herself and going to a conference. And so at some point, hopefully in the near future, we will have a bit of capacity to do more of that communication that you're talking about, Carol. But thanks for the feedback. Okay.
Was that a sincere thanks?
Yeah, no,
Well,
thanks
if
for
we-
thanks for
salute,
keeping it at the forefront and elevating it and making sure it's on our radar, and we're moving as fast as we can, but I do appreciate it. The other update is that we recruited for a grant researcher and writer, and the recruitment did not yield any applicants. And so now we are hopefully contracting out for some grant research and writing sometime in the near future. And once I have a more tangible update on that, I will share it. So locally, an update, the city and county are one of the 8 pilot areas across Oregon that are going to be receiving funding over the next 2 years. And there's some requirements outlined in the legislation that this funding has to be used for, to create a coordinated homeless response office and a 5-year strategic plan, communications, 1 point of contact. So if you're interested in all of the requirements of this legislation and what the city and county are going to be endeavoring to do in the next couple of years, it's House Bill 4123. Right now, we're working to meet immediate deadlines and start the process of meeting all those requirements outlined in this pilot legislation. Andrea, can I pass it back over to you? I wanted to share this great update for Corvallis Housing first, but you're the better person to share it if you're able to talk right now.
Sure. Yeah. We are super excited. We've been, we just found out that we were accepted into the Supportive Housing Institute, which is just wonderful. I think there's 10 or 12 other sites that are in our cohort. We start next week, actually. We have a great team. So it's myself and Hezekiah Franklin from the Drop-In Center, who works the Drop-In Center. You may know Hez. Anita Earl, Dan Easdale, who's our lead case manager, Christine Mossbaugh from Benton County Community Health Centers, or Community Health Centers of Lynn and Benton County, sorry. Kim Shellman from Cascade Management. So they do a lot of property management for like Dev Northwest properties in our community and other affordable housing properties across the state. And I'm probably missing somebody, but we're really excited about it. So the other thing that it does is we also approved a designer, or not a designer, a development partner. His name is Mike Andrews. He's out of Portland. Start recruiting architects and builders this summer. So everything is moving forward. But the Supportive Housing Institute is really great. So if you want to know more about that, let us know.
Congrats. This is the 3rd time's the charm on applying for this. Oh, you go. That's a huge amount of support and technical assistance that Corvallis Housing First is going to bring to this community. Hats off to you.
It's going to be awesome. Thank you, Julie.
I have an update. I know that everybody is interested and eager to be able to do some more in-person meetings, or at least have the option to do hybrid. Some people be in person and then folks can tune in virtually. So Kaylee Olson and Samantha Bailey, our health department administrative support person, we are doing our best to figure out if it's possible. But a lot has shifted and changed over the course of the pandemic. Certain tech equipment has been moved around based on different county needs. So right now we're trying to figure out what tech equipment we need, and how we can get the kind of support that we need to make sure that there is no difference in experience and ability to participate for people in the room and people tuning in virtually, so that we have the right video equipment and microphones and sound. And we're just not there yet. And George, I know this was really important to you, so I wanted to make sure to follow up on it. We're working on it, but we're probably going to need to order some more equipment and get some more support and training on it. So it's not going to be happening at the May meeting, but I'm going to keep moving it forward. Okay, I think there are only a few things left, folks. So the co-chairs, roles and responsibilities, I just wanted to bring them up here again to remind folks. And we have one person who is interested in being another co-chair. You all elected George Grosh last time, and he joined the executive committee meeting for the first time this month. And now we have another person who is interested in being the second co-chair, and I'm thrilled about that. So Bria, please share with us why you're interested in being co-chair before we do an election.
Okay, there you go. So I'm mainly interested, sorry, I'm doing like 6 things at once. I'm also on my computer. But I mainly want to be co-chair because I do want to be more involved. I did miss a couple of the meetings, including the research meeting. But I was actually trying to read as much as possible to catch up with everything. And I just want to be able to become more involved and be able to, be there and also be able to assist and answer questions, because I know I sit here just kind of listening a lot. And I know that's not saying that I'm not participating, but I want to be able to like be more involved in the conversation and see what I can do for not only the Hope Committee, but also the council and just the entire city itself, because I really do love it here. And I want to, I want to make sure that other people don't go through what I've gone through, and be able to help them out of the situations that they've already found themselves in. And I think that just being able to do that and being here by itself alone is just like amazing, that I want to be able to move that forward, if that makes any sense to everybody.
Yes, thank you, Bria. I'm really thrilled that you want to be more involved and be part of the executive committee and help guide the agendas of the Hope Board going forward, given the experience that you've shared with us all. Thank you. We will need a motion to vote to elect Bria as one of the co-chairs.
So moved.
So
I heard Carol first. We'll say Carol Butcher moved, and I need a second, Charles.
I will second.
Okay, Charles seconds. There we go. I am not going to go through the whole list of Hope Board members because I can see most of you. So if you can please share your screen so that I can see thumbs up for this vote. I can see everybody, I think, except Reese and Nancy Wise. Thank you, Reese. Please give a thumbs up if you vote to approve Bria as our Hope co-chair and serve on the executive committee. I am seeing all thumbs up from folks. If you can note, Paula, that this was a unanimous decision by all board members in attendance today. Thank you, and round of virtual applause for Bria. Thank you for stepping up to be more involved in this. We're thrilled to have you here. George, you wanted to comment?
Just a quick comment that I've noticed that there's been as many as 36 people here today, and it's really exciting to see that not everybody's just Hope Board members. There's a lot of other of our community partners that are out there that are here looking seriously at the topic. I'm sure the topic of coordinated entry was probably part of what drew people here, but I was pleased to see the draw that was here and the work that is happening on the data committee in terms of looking at what we're researching and going in the future. I've got some, Julie will talk, I've got some ideas about what I want to see on the executive committee agenda to talk about some of those things, because there's some opportunities for us. So thank you for everybody that came.
Thank you, George. I did a bit more targeted of an effort to make sure that our service providers and other community members knew that coordinated entry was going to be the educational topic tonight, because a lot of people ask about it in different avenues. And so it seems like spreading that word was really helpful. So yeah, I agree with you. I'm really glad lots of people tuned in tonight. Congrats again, Bria. I'm going to move on to our last slide, which is just one more update about next steps, and we'll see if there are any questions before we end the meeting. So the research work group is going to continue to meet on all the topics that Andrea touched upon to decide what research to bring forward to the board at what time. And it will also inform the educational topics. So next meeting in May, we have Judge Blake and Judge Donahue from Drug Treatment Court and Community Court, respectively, who are going to be coming as our educational component. They're going to talk about what DTC is, what community court is, how they work with people, how they collaborate with providers in our community, and what they're doing to really help folks whose needs cannot be met by incarceration. At the June meeting, our street outreach and response team lead, Maddie Bean, who is here tonight. Thanks for attending, Maddie. She's going to be here to share what it means to do street outreach and response. She's the only paid half-time person who does street outreach and response in our community. And so she's going to debunk some myths about that and what their processes are and procedures and the training that they do and how it's trauma informed. So I'm thrilled she can join us. And then a couple other topics I'll be pursuing for this summer. Inner Health Network Coordinated Care Organization. What work and investments do they do to target homelessness or population health community-wide? And so I've been following up with Melissa Izavorin and Bruce Butler to see who can come and share that information with us. And then Housing First. What's the definition of it? And some policy examples and practice, because I know that's been really important to lots of our board members. And I believe that is it for today. So I'll stop screen sharing. Are there any follow-up questions from everything you all heard today or talked about today, or comments, or how you feeling about any of this?
Is this fairly similar to what Joel was advocating earlier on when we heard these two reports? I was trying to remember, Joel's talking about coordinated entry and the Maine or Massachusetts model. And we had somebody come and talk to us about it. Is this kind of parallel to that?
I think there are some parallels. I think that one of the differences, at least in my mind, that stands out is the situation table or the hub model that we had talked about before with the folks from Massachusetts. Rather than sort of having multiple places where people can sort of enter the system, so to speak, to a large degree, we're bringing the system to them. The situation table, to me, is really a lot more about finding the people that are at high risk, and that could be EMTs, police, it could be folks at the emergency room or the sort team or whoever it is. And we bring that information to the situation table, who then customizes a plan to go out and meet that person where they are, rather than sort of waiting for them to get to that place where they can have the entry. Coordinated entry, I think, has a lot of similarities because it's getting people together, it's getting people on the same page. But to me, that's sort of the one standout of how the situation table is just a little bit different.
Yeah, thank you, Joel. I agree with everything you said. The situation table is more the routine meeting to convene people from different systems to talk about individual situations. Whereas coordinated entry is how do we coordinate across all of our providers so that we have consistent data being gathered and understanding the vulnerability of people in our community. I'm getting a little bit of feedback from someone. If you could mute your mic if you're not trying to share. Other questions or comments from today, or things you'd like me to follow up on, or thoughts you had?
Absolutely great information.
Thank you, Cindy. Do you feel like most of it was new for you, or did it round out your understanding?
I think it more rounded out my understanding because I've been trying to do a little bit of reading on the side, but I really appreciate both James and Melissa's presentations. They were fantastic.
Thank you. I agree. I did quite a bit of groundwork to try to find communities that were farther along in their coordinated entry process than we are and meet with them individually. And Melissa and James are the most enthusiastic and interesting folks from some of the best counties as far as coordinated entry goes. And what I really liked about both of them is that both of them started out as case managers, frontline folks who were out trying to help people experiencing homelessness. And so they have that on the ground perspective of, trying to ask people these really personal questions. It needs to be done in a trauma informed way. And now that they're more at the director of HMIS level, they understand the on the ground level. And so I was really thrilled that they could come join us. Any other questions or comments or follow-up? Anything you'd like me to bring back on this topic?
It definitely opened my eyes that DC has a long way to go for its homeless people.
You're talking about DC, the District of Columbia back east, Bria, where you came from? Yeah. All right. Well, thank you, everyone. We can go ahead and adjourn a few minutes early, and I will see you at your May meeting. Thanks, Hope board members and all the folks from the community who tuned in tonight. I learned a lot, and I hope you did too. Take care, everyone. We'll see you in a month.
Thank you, everyone.
Paula, how are you on notes? Are you good? Okay, great. Good to see you. Ricardo, thank you for being here. Oh, I guess you left. Bria, good to see you. I'm so glad you could make it tonight, and congrats on the election. I will add you to the Hope Executive Committee meeting. It's only 1 hour on Wednesday. It's the second Wednesday of the month from 4 to 5 p.m. So I'm going to just send you the routine meeting invite, and you'll meet the second Wednesday in May for the first time. And, you know, if you would like to, we can have a phone chat about it before the actual meeting, or we can have a virtual talk. If that would make you feel more comfortable going into the meeting, or if you want to ask questions, would you like that? Okay. Okay, why don't you text me or email me when might be a good time next week or the following week, like sometime in the next couple of weeks, what would work for you? This is my full-time job, not yours. So whenever it works for your schedule and your work schedule, you just let me know. Okay, thank you. I'll go ahead and close out the meeting. Bye.